Welcome to Credentialing Chronicles, where we spill the doctor's tea, honey, hotter than your morning coffee.
And we're spilling it across America, state by state and license by license.
Ooh, I'm Shannen, and honey, she is Nyleen. And we are just a couple of sassy credentialing pros with front row seats to all this crazy chaos.
Yes, from coast to coast, fraud scandals to hospital drama they hoped you'd never find.
Yeah, but we find it, girl. So grab your coffee, your compliance checklist, and what, Nyleen?
And let's get into it.
Yeah, oh yeah. Well, Nyleen and Shannen sitting there talking about you while you pull up a chair. They holding every.
Okay, y'all, welcome back. Thank you so much for stopping by Credentialing Chronicles. How you doing, Nyleen? How's your week been, baby?
Oh, all good, all good, all good. In the hood over here. But Shannen, where are we going this week?
Oh, we are going to the place of volcanoes and coconut trees and lays, honey, and hula girls. And I'm talking Hawaii.
Okay, so for all intents and purposes of this episode, are we supposed to say it like Hawaii? Because, you know, they have like this special accent, like Hawaii. Like, you know, are we supposed to say it with their accent? Or is that like, nah, I don't know.
Okay, let me try it. Hawaii.
Yes, I don't know. Listen, we don't want to offend anybody. I just want to say it right.
I just want Hawaii. Okay, we are in Hawaii, baby.
Oh my goodness. Okay, so
are you ready?
I am. So we should say
to
Aloha.
talk about the most archaic state of all of the United States.
But they're so beautiful, though.
They are beautiful, but you know, we contract a lot for people in Hawaii at AQC.
Oh, really?
Yes, girl. And every single process, you know what it is? Paper. Even the Medicaid. The Medicaid.
Oh my goodness.
Even the Medicaid. It's an application for every single thing. They ain't got a portal. It's long and drawn out. I mean, but the ladies are really nice. If you talk to them nice, ask them about their kids, you know, you can get some movement, because you're still assigned a rep, you know, like how it used to be here in the States. And so, you know, it is nice because once you get a rep, then you're good, but it's an archaic process in the contracting world, baby.
Ooh, so, well, aloha, besties. We still love you. Welcome back to Credentialing Chronicles, spilling the tea across America.
And I'm sorry you got to go through that.
Okay, well, the vibes are tropical, but unfortunately, like you said, I guess the compliance is not.
Yeah, and if you've ever tried to verify a Hawaii hospital affiliation, Nyleen?
Oh, I have. I just gave up. I'm not going to lie.
It's a personal episode for you is what you're saying. That's what you're saying.
Yes.
You're saying
yes.
We both have been traumatized from Hawaii.
Yes. The fact, if you're saying archaic system, girl, the faxes don't even work. Nothing.
No, and I'm going to tell you, if you are a medical staff professional in Hawaii, please comment, share, like us, please, because we want to know, is it easy for you? Do you find it hard? Do you need us to help you, support you in technological advances? We will help you, boo.
So there's provider shortages, infrastructure failures, public health emergencies, fires, volcanoes erupting. Girl, there's just a
people
whole
down
lot
there going there
on.
to buy the land up. They just haven't. Oh, my poor Hawaii people. I love y'all.
Okay, so let's start, I guess, with like the headline that's quietly shaping our topic of conversation, which is the Hawaii's physician shortage.
Yes. Oh my God. Start there. Yes, we're ready.
Okay, so according to the Honolulu Civil Beat, a University of Hawaii workforce assessment report found that 12,688 licensed physicians. So that means, but then they have only 3,600 provide patient care full time.
So what's happening? What's going on?
So then just because they're licensed, right, What does that mean?
That they're not available. I mean, they're on the beach getting them a little tan. I mean, I just don't know. But maybe people are healthier. Are people healthier in Hawaii?
I don't know. Well, the Civil Beat reported that the shortfall was doctors that, like, geographically, right? There's a lot of islands that make up Hawaii, and then it like grows and grows, and the numbers change because there's, I guess, not the same number in every island, and there's a little bit here and a little bit there. I don't know, but there's a really big gap of full-time physicians versus licensed physicians.
Yeah, I could imagine, because even the little islands, it's like, are all the doctors living over there? And then there's like, what, 100 people? So I mean, I can see how the inconsistencies, I mean, especially in an ER, right? It doesn't magically cover an ER on the big island if you're on the island of Waikiki, you got to take a boat, with the broken leg, with the open fracture. That's hard.
But their weather's better than Alaska. They seem to have a bigger problem than Alaska.
Yeah, Alaska. Yeah. Well, Alaska, they just got it down, honey. They've been doing it for so long. But again, I don't know. Maybe there's just not that many problems over there, I mean, we really don't know. We really need you guys to comment. Let us know. What is it like? Are people sick? Are people not sick? There's sun. It's beautiful. Maybe everybody's healthy. Maybe we need to go to Hawaii.
Well, the island reality means that some specialties, I guess, can't be shared the way systems try to share resources on the mainland. And when shortages deepen, risk patterns change. So obviously you're going to see your delays in diagnosis, overloaded ERs, right? Or emergency departments, specialist bottlenecks, providers working stretched and tired.
And that's where what? The cracks happen, the mistakes happen. Guess what? The lawsuits happen, right? I mean, that's what we see every time.
Mm-hmm.
Yeah, so that's a lot to think about. And I mean, again, we really, really, really want to talk to you. We really love to engage you if you are on the mainland, because when we were looking up, there's not even a lot of credentialing information on the mainland. I know just from experience, doing contracting for many groups out there, that it is a headache, and that's why they look for, outsourced help,
So you did bring up our MSP reality, because hospital affiliations are brutal. And it's not, I don't think it's because they don't care, but I guess time and distance turn simple tasks into like week-long sagas. So where you have to wait eternal, like the 6-hour time difference is actually like, really 72 hours, something like that, before they actually got our verification request. I'm not sure.
That's something to think about. So Hawaii runs on standard time, right?
On Hawaii Standard Time.
On Hawaii Standard Time. Okay. And the mainland teams are emailing when the Hawaii islands are closed, because, there's that 6
It's like 2 o'clock in the morning, right? When we start.
It's like 2 o'clock. Yeah. And then by the time they're replying, the mainland people are getting off of work. And so they ain't worried about it no more. So, yeah, like you said, it just takes a couple of days. And God forbid it's a weekend, honey.
So then you add holidays and then staffing constraints and then smaller admin teams, and then it just creates a verification lag. And what that does is now it impacts onboarding timelines, locum start dates, coverage gaps, right? And sometimes it just makes us rush all of the stuff.
And what is our famous line that credentialers use? I'm just circling back. I'm just circling back to follow up. I'm just circling back to see if you got everything. If you need anything, can I get what I need, please? I'm circling back.
So then is it just that they're unresponsive, or is it that they're overloaded? What do you think?
Yeah, I would say probably 90% overloaded. I couldn't imagine, and the women and the men that have been doing that in this job in Hawaii, I know on the contracting side, have been, honey, at this company for 25 years, doing the same job. And, I just find that when people, when they're bogged down, it's hard for them to perform. You can't speed up if you're tired, because they got you working so hard, right?
Yeah, for sure. Absolutely. And even though they don't have all of these quote unquote active doctors, they're still licensed doctors. So they might still be on staff, just, traveling through or running through. And I'm sure their locums numbers are crazy as well. So that's a big problem.
Yeah, especially when you're doing those locums and then they leave. Oh my goodness, that's a nightmare. So, I mean, did you find anything out about any murders, any?
Well, there's like a public health crisis, which was crazy. And then, according to the US Environmental Protection Agency, in November of 2021, a petroleum release from a storage facility contaminated the drinking water. So hundreds of families, yes, and hundreds of families reported odors and health symptoms from the contaminated water. So now you have an overloaded health system and a health emergency.
And how is their water contaminated? I mean, talk about challenges, obstacles. I mean, you isn't the job to keep people healthy and alive.
Yes, and then that's like the ripple effect. So you have an actual problem, right? Or you have an emergency, and then you have the trickle down. What's going to happen? Relocation, people, problems, health, access to health care is a problem, monitoring. So that's some serious stuff.
And it is. I mean, it really is. It's a reminder, like how do the people, get away with keeping it all together, when it's run on a slim, a shoestring budget, right? Isn't that what they call it, a shoestring budget? And it's like, and then they just want people to do more with less, and that's hard. That's hard.
So let's move on to how is this real story? The state of psychiatric facilities.
Psychiatric, okay.
Well, mental health, right? According to Honolulu Civil Beat, the cost to fix defects at a newer Hawaii State Hospital building climbed to over $37 million just to recover costs tied to construction deficiencies because of mold. And then lawmakers, were shown pictures of deteriorating equipment, clogged drains, leaks, mold serious enough that the building's safety and functionality were put into question.
And they're spending $37 million to get mold and leaks.
Well, they had already spent, right, $160 million.
Oh, it totaled to $160 million.
Yes.
Woo! That's crazy.
Yeah. So you have all these other issues because how are you going to be able to treat people if you don't have a place to treat people at?
If it's not healthy, how you going to get people healthy in a place that's not healthy?
So now you have a shortage of doctors, you have a shortage of facilities, and the facilities you got mold. I don't understand. Hawaii, what are we doing?
I mean, I'm just saying it. I just don't understand how we're getting people healthy. I mean, it just seems like their healthcare system is just being truly neglected. I mean, that's what it sounds like, right? Like nobody's taking care of it.
Mm-hmm.
We are feeling bad. The Hawaii episode is not going as full of sunshine as we had hoped, Nyleen.
I know. And then you brought out a peer-reviewed article in PubMed Central, talked about another concern about Hawaii and the Hawaiians is that Native Hawaiians and other Pacific Islanders experience a disproportionate poor health outcome situation because they include high rates of overweight and obesity, hypertension, asthma, cancer, and health insurance alone will not eliminate disparities because barriers beyond coverage really affect access and outcomes. So you have a population of people who have serious health issues and they don't got a building and they don't got a doctor.
That is, to me, that is just crazy because, a translation, you can have your insurance card and you can, have done everything correct and you still don't have real access to timely, cultural, safe care, right? Reachable care. I mean, that is just, that's a problem that really needs to be fixed. We really need to, because man, oh man, I could not believe that.
Yes, and no pun intended, right? But it's like it really is a perfect storm because there's provider shortages and then there's geography because you can't change the fact that you are just a group of islands. And then you stack that on top of disparities.
Yeah, and it's just one thing after another. Yeah, and it's not, it's a quality issue, right? It's outcomes, readmission, delays. I mean, everything that you don't want, is what's happening in Hawaii, and that's terrible. I mean, it just doesn't seem fair for the people of Hawaii.
And then can we talk a little bit about that crazy story that you had sent me on the phone that everybody was talking about? I think it even made like the nightly news, national news.
The nationals. Oh my God.
Yes, girl. Content warning, alleged violence.
And we haven't credentialed him. We don't know him. We just out here getting public information.
Yes. So according to the Hawaii News Now, a Maui doctor was arrested after police said that he allegedly, remember, we have to use that special word, that he allegedly tried to push his wife off a cliffside trail in a lookout area on Oahu. Yes. And struck her with a rock. Yes, with a rock.
Yes.
And then some sources also reported he allegedly tried to prick her with syringes. Like, pricky, what?
Of what?
And then it was a 6-hour manhunt, which ended with his arrest.
Oh my goodness. And before anyone asks, we're not naming names. We're focusing on what the system does next. We're not, we just wanted to spill a little tea because we know that y'all heard about this case. I mean, it was everywhere.
Exactly. But here's the credentialing point. According to reporting, following the arrest, the physician's privileges, guess what? Were suspended pending investigation.
Which is the proper thing to do.
Right. And then later developments is according to the Hawaii News Now, a judge addressed whether certain evidence should be sealed or unsealed with arguments about publicity and then a potential jury impact because he's a doctor, because of who he is and what he has.
And this is where credentialing intersects with reality, right? It's the privilege suspension, the risk review, the reporting obligations, the documentation. And then how does the patient actually know? How do medical staff professionals find out?
Yeah, and this is where what you say matters because Google is your best friend. Because all you have to do is Google his name, girl.
That's it. Google alert. Set a Google alert.
The cases go worldwide in minutes. And if your process doesn't include this, it's a reputational and very much risk flag, right? You are behind the times.
I mean, even our verification pages, all of our files include a 2-page Google review. Just to get everything. And you can't just depend on 1 page. It's got to be 2 pages, I mean, but again, that's why you use Baton.
Yes, we don't have to wait. We can just go on Baton, put in their MPI number. How do we keep up with these verifications and fragmented portals and time zones in 2 seconds? I can go and look up as much as I can, track my expirals.
I need to get me a Baton portal. I need to get with Robert. He had told me to get with him, and I just didn't yet because I just had been so busy. But now I'm ready because, girl, the way we be talking about Baton, I'll be ready.
Yes, it's amazing. It's a lifesaver, and it's a reliable system, at least get Hawaii, girl, because
it wasn't happening without Baton, basically, is what you're saying, right?
Exactly. So here is, I guess, kind of the big picture. Is that Hawaii isn't dealing with just one scandal. It's dealing with stacked pressure because you've got provider shortages, you've got paper processes. Mm-hmm. So you mailing out Medicaid applications. What is that? Are you serious? I can't believe you're actually doing it on paper.
On paper, honey. And the goal isn't to work harder, right? It's to work cleaner. That's always our goal.
So you have more defects because you have facilities going down. You got natural disasters happening.
Say it.
You have disparities in these islander communities and different ethnic needs. And then you got some doctors trying to kill their wives.
Yeah, not the global news, honey. And when pressure starts stacking, governance has to be tighter, not looser. I mean, they really need to look at the infrastructure and say, what exactly can we do to fix things, And I mean, what can the doctors do out there? I mean, how can the doctors help? Do we even have a PSA for the doctors?
Well, if you practice in Hawaii, how did you get your license? How hard was it? I don't know. I'm just wondering, because if everything was paper, recognize the reality. If you're going to go work in Hawaii, you might have to work a little bit extra than you do in the how do they call it? The mainland in the United States. But protect yourself, protect your documentation, and keep track of every letter that you get, because we may ask you for your appointment letter because we can't get it from the medical staff office. And if you have a point of contact, please save that one too and let us know, us little people in the mainland, that you came to Georgia from Hawaii. And now I have no idea which hospital you were at, because we can't find the medical staff office.
Remember, we did the episode on that doctor that came from Hawaii and went to Texas, the OBGYN. Remember him?
Yeah, he kept his Hawaii license and he didn't get a Texas.
Yeah, he was military. And if something happens in your personal life that can trigger professional risk, you guys, get legal counsel early and follow reporting obligations. Don't let silence become a second crisis for you, because then that gets, even more reportable, and you don't want extra problems.
So MSPs, Hawaii is a time zone and staffing reality check, but please build your process. If you are an MSP out in Hawaii, we need to hear from you, because we need to know what we need to do. Please, we need to know what to do, because we are at wit's end. We want to get the hospital affiliation verification. If you don't use a credentialing database, why not? If you need help finding one that's affordable, let me know. Reach out. I can help you. Document every attempt. Timestamps matter. Make sure your fax machines work. If not, email is great too.
Email is amazing.
Don't rush your temporary privileges, but make sure you're credentialing effectively.
If you live in Hawaii and you're getting care is hard, if wait times are long, ask about telehealth options maybe. And where can you go for urgent escalation? Keep a personal medical record binder on you, or a folder, something with all your referrals, your images, your meds, because honey, delays happen. And if you have all your stuff together, it'll help your stuff not be too delayed. And if your water or your environment or exposure is a concern, a document system, a symptom, and, seek guidance, from maybe official public health resources, and then advocate for yourself without apology. Bring somebody with you, advocate for yourself. Don't play, keep yourself safe.
So Hawaii is breathtaking, but it's also a case study in how geography, infrastructure, workforce shortages, and oversight really intersect.
So paradise deserves protection and systems that match the stakes and keeps everybody healthy, and we're here to support you. If you ever need any help from all of our MSPs in Hawaii, or if you want to spill some tea, let us know. We'll do bonus episodes of Hawaii.
Girl, yes. So stay credentialed, stay skeptical, and keep spilling the tea. Well, responsibly, of course.
That was a whole nation's worth of tea, girl.
Ooh, and we are just getting started. More states, more scandals, and definitely more receipts.
And if you love the tea we're spilling, you gotta comment, follow us, share, do everything. Where can they do all that at, Nyleen?
They can follow us on LinkedIn, Instagram, TikTok, Facebook, on all the things. And share it, because the tea is going coast to coast.
Ooh, I love it. See you next time on Credentialing Chronicles. Remember, you got to stay credentialed, but not what?
Not canceled.